Day one post-op. Tell the people what you did today.
Got up at like 7, had breakfast, changed, got ready, brushed my teeth, washed my face, put on some makeup. So
Put on some makeup.
I don't look dead.
So you know she wasn't feeling too bad.
Not unbearable pain. It's very manageable. It's still painful.
And you nausea today?
No, because I had that patch they gave me. Being in this much pain and throwing up would be the worst. Yesterday I felt like a burning sensation, mostly on my butt and my arms, but today just was like really sore. Like I went to the gym and worked out really heavy. My butt is the problem. You can feel the little drains, so if I like move a certain way, it feels like it's pinching. Manageable. It's like I have a 1,000-pound sandbag in each of my ass cheeks. Like it's heavy. It's only day one.
So my first day post-op, actually, I didn't feel too terrible. If you see, I got up that morning, I got dressed, I put on some makeup so I could just feel more like myself, which did help. I went to my hyperbaric appointment, I saw my doctor. The hyperbaric did make me feel nauseous. I didn't know this at the time, but after I went for 5 hyperbaric sessions, and after each session, I would get really nauseous. One thing I will say is after surgery, I had no appetite at all. I was not hungry, just regular foods that I like to eat, I did not enjoy. It was hard for me to like force myself to eat, but I made sure that I had protein shakes, so I at least tried to supplement that so I was getting a good amount of protein in. But yeah, no appetite, trying to drink as much water as I could. But when you have this faja on and you have so much padding, like anything you eat, drink, it just feels so tight, you feel uncomfortable, you feel bloated. So just keep that in mind. I think I should have had more like smaller meals or like snacks throughout the day versus trying to eat like one meal at breakfast, lunch, and dinner. One thing that really helped me was trying to keep this day routine that I had as close as I could before surgery, after surgery. So I still like to put on makeup, do my skincare, get ready for the day, because I felt like I had nothing else to do and I was driving myself crazy. So doing just those simple things helped me feel more like myself versus like a sloth.
Our method.
Oh, I'm sorry. Oh, my back. It's killing me.
So if you see in this clip here, they're still putting on my SEDs, which I wore for about the first 48 hours after surgery. Even though I was getting up and walking around and I had my compression socks on, we use the SEDs just as an extra precaution to prevent any risk of blood clots. So I had a lymphatic therapist come to me after surgery for the first 2 weeks, which I highly, highly, highly recommend unless you have a lymphatic therapist that is down the street from you, because just doing the simplest of tasks and going out is so physically exhausting. So I don't know how I would have been able to sit in the car for 20-30 plus minutes there and back, also getting a massage. So I was really grateful that I was able to have Alejandra come and do my post-op lymphatic massages at my house for the first 2 weeks.
Why you come around? Just gonna let me down. Just wanna keep me around. So when she gets
So about an hour before my massage, I took pain medication because I kind of was anticipating discomfort since I was uncomfortable even just at rest, which I'm so glad that I did because my first massage was very uncomfortable. I know they say it's not supposed to be painful, but everything just, your skin, even just your skin is so sensitive, the lightest touch is uncomfortable, I would say.
How did you get with that beat for me? Real love is deep for me. I'ma make you go weak for me. Make you wait a whole week for me. I see you watching, feeding. I know you want it, scheming. I know you need it, drug lord. You want it all, you do not know.
So my lymphatic therapist has a red light machine. She always starts at the beginning of our treatment sessions with putting it on the abdomen. That's the area that's typically the most swollen after surgery. So the red light therapy distributes light to the area that it's over. It helps the cells absorb that light, which will repair. It reduces swelling, inflammation, and also can help decrease pain. So initially she will put it on my abdomen, and then when she's working on my abdomen, she will move it to my arms. Those are the areas that I experience the most swelling in.
So we're going to be using arnica oil just to help this recovery process.
A pro tip, I would wait to shower after your lymphatic massages because they put so much oil while they're massaging you. You don't want to be sitting and sleeping in that oil because it can cause an acne breakout. So shower after your massage. My lymphatic therapist here, she's using arnica oil, which helps with swelling and bruising. She starts at my chest, she goes to my arms, my thighs, and then the abdomen. The lymphatic system is all over your body, so make sure that your lymphatic therapist is massaging all of those areas, because if they're just massaging the abdomen, it's not stimulating your whole lymphatic system to reduce all of that swelling and get those toxins out of your body.
I should be a lover, I should be your friend. I don't see the issues made up in your head. Money can pay for your time, but it's not love.
So obviously my legs, I actually didn't really experience that much swelling in my legs, which was really nice. But my chest area, no pain throughout all of my lymphatic massages. My arms have been the worst, and even to this day they're still tender, and I'm at about 6 weeks post-op. My abdomen felt so tight, like my skin was just so tight, and I don't even know how to explain it, but when she was massaging it, it was uncomfortable, not so much pain, but the arms are definitely painful.
I should be a lover, I should be your friend. I don't see the issues made up in your head. Money can pay for your time, but it's not love.
So she massages the legs, as I mentioned, to stimulate the whole lymphatic system. I was lucky enough that I didn't really experience significant swelling in my legs. They're a little bit swollen in my thigh area, but my feet or my calves, my lower legs, didn't get swollen. However, that is a possibility after surgery. There's some people that look like they have pregnancy feet where their feet swell up really bad, and that's normal.
I should be a lover, I should be your friend. I don't see the issues made up in your head. Money can pay for your time, but it's not love.
So she initially started off, so obviously my first session, she was very gentle with me, just lightly touching the abdomen area. You don't want to do anything too rough and cause more trauma to the body. And then as my sessions went on, she was able to go harder and deeper to doing her massages. I want to give a disclaimer that every doctor is a little bit different, but my doctor specifically said no wood therapy or use of any machines until after 12 weeks post-op. So this is purely just manual lymphatic drainage massage. She's only using her hands, no other tools are used. The center of my abdomen was really sensitive. Like I said, it was really tight and tender. It was painful, but I mean, I just had to push through.
On a scale of 0 to 10, the abdomen.
It's 10.
10? You're taking it like a champ, though.
I remember my back also being really sensitive. She has like a foam pillow to put behind your back to offload the pressure on your butt, but my back was so tender that I couldn't. It was way too painful, so she just removed the pillow and put wedge underneath my legs and my butt to offload some of that pressure. I didn't get that much bruising. The most bruising I got was on my arms and then on my hips and my butt. I used a cream that my doctor recommended, and the bruising honestly was gone after the first week of surgery. There was very minimal bruising after that. She had me stand for the back because I wasn't able to put pressure on my breasts yet.
I should be a lover, I should be your friend. I don't see the issues made up in your head. Money can pay for your time, but it's not love.
I didn't get dizzy or lightheaded for my first massages. It wasn't until like after like my 2 weeks were up and I went into her studio that I did have a faint episode, like twice. I didn't actually faint, however, I just got really lightheaded and I started to feel really dizzy, so I just sat down and I drank water until that feeling passed. This was my first and second day post-op. I got my massage on day 2 after surgery. I completed 10 sessions. I still am gonna go to my lymphatic massages just because I still have a lot of swelling. I shouldn't say a lot, but I still notice a lot of swelling on my back area. I feel like that's kind of my problem area right now, but it's really important to do your massages. Obviously follow your doctor's recommendations, but my doctor recommended a minimum of 10 sessions, and if you feel like it helps you, you need to do more. That's all. I hope you guys are enjoying watching my journey, my surgery journey. If you guys have any questions or if there's anything specific that you want to know about the recovery process, feel free to comment down below or send us a message and then we can help answer those questions for you.
I'm never sour, I'm just smoking something much louder. If I do this every day,